Hi folks, John Adamson, the Rehab and Documentation Guru. So I'm reporting to you on something that was published by the Center for Medicare Advocacy, and you've heard me talk about them in the past. And they are kind of a watchdog organization on Medicare rights being violated by either Medicare itself, which does happen, or different agencies. And one thing that they're tracking is there are nursing homes that are appealing to their states for immunity against liability, medical tort liability as it's called, for COVID-19 deaths. Now, I'm a little bit mixed on my perception of whether this is right or wrong. On the one case, it has been reported that up to 90% of deaths, and I don't know if that's quite accurate, from COVID-19 are occurring with nursing home residents. And you think about it, what do we know about this disease? It attacks the most vulnerable. So who is the most vulnerable? It's the aged with lots of comorbidities. And where do you find those people often? In nursing homes. So it would make sense that this would most disproportionately hit nursing homes. The other thing to think about is that nursing homes, if they can't pay their bills, they can't stay open. So if you've got, let's say your facility gets hit with COVID-19, and like we've seen in some facilities, they lose maybe 10 or more residents, suddenly their income stream is significantly declined. We also do know that there, across the board, agencies and facilities are seeing reduced census. So you're seeing these facilities having mass amounts of empty beds. You throw on top of that a lawsuit, whether it's justified or not, to basically find them culpable for the deaths of patients. That could decimate the nursing home industry. So that's one side to look at. But the other side to look at is this. We do know that unfortunately the nursing home agency or agencies and the facilities are plagued with incompetency. I can say that. I worked for 10 years in the nursing home industry at a managerial level over multiple facilities. And it was pretty much pandemic that they had problems, that they had a lot of issues going on. So they probably have culpability in some cases. And unfortunately, most of the care is delivered by untrained personnel. I'm talking about the custodial care, the day-to-day bathing, dressing, feeding, things like that. And the nurses have very little to do with the patient. So you have these low-trained individuals doing most of the care for the patients, and probably not thinking through always the consequences of their hand hygiene and use of PPE and things like that. So there is culpability. So this is something that's being tracked right now, and it's something you might want to pay attention to in your state. If you know of any malfeasance on the part of your facility that you work for, or other facilities in the area in causing the spread of COVID-19, those facilities do not deserve to get immunity from having medical tort liability. Anyway, John Adamson, the Rehab and Documentation Guru, just keeping you up to date on some of the trends that are going on right now related to COVID-19. Hope you have a great day. Take care and God bless.